66,000 Americans are now estimated to die by August from COVID-19. While the projected death toll has risen by 10%, health officials are warning that a deadlier wave is possible coming this winter.
Our chief health editor, Dr. Parthanandi, is here to explain. So first of all, Doc, why are the projected death numbers higher than before?
Alan, there's a couple of reasons. The number changes as the data is updated in the main model that's used to predict the future number of American deaths. So when we have higher deaths across the U.S., the estimated number will go up. And some of the state death tolls have really increased because nursing home residents are now being counted as presumptive positives. And on top of that, we're expecting an uptick in numbers as some states, as you know, prepare to ease restrictions, allowing some businesses to open back up starting as early as this Friday. The bottom line is that, listen, if you don't take the proper precautions, then this opportunistic virus will easily spread.
Please tell us why a deadlier wave is possible this winter.
So Glenda, this ominous forecast, this deadlier wave forecast comes from the director of the CDC, Robert Redfield, and he's warning that come fall and winter we'll still likely be dealing with the coronavirus epidemic, and then the flu season will start back up. Having both of these at the same time could really be a recipe for disaster because both affect the respiratory system. And we've already seen how hospitals have really struggled with not having enough tests, ventilators, and respirators for patients, as well as not having enough PPE or protective gear for healthcare workers. So if these issues are not properly addressed, then our hospitals and healthcare system could really be overwhelmed. Then that will directly affect patient care. That's not a good thing.
So, Dr. Nandi, with coronavirus and the flu season, I assume that getting a flu shot would actually be very helpful, right?
100%. A flu shot, Alan, is extremely important. Now, it will not protect you against COVID-19, but it can help you protect against the flu, right? So I highly recommend you get the flu shot before influenza season kicks off, and that'll help keep hospital beds open for people who do get infected with the virus and need medical help. Of course, we'll still need to practice prevention techniques like washing hands, right? Disinfecting, covering coughs and sneezes, very important still. We may still have to have social distancing guidelines to follow as well because we're in uncharted territory, and that's why it's so important that we work together. Really the best route to overcome the virus, and I'm sure we will. We just have to think ahead and then plan ahead, do the right things that we know we can do.
So enter flu season, and that's the recipe for disaster.
Absolutely. Absolutely. But we can do that. We can get the flu shot, do all the things we're doing now, like, washing hands, disinfecting. That also helps with the flu, right? And so covering your coughs and sneezes, all that'll help because it will not add to the burden that's already there when the coronavirus is also coming.
All right, some good information.